Okay. So yeah, let's start with just talking about, again, Jody, thank you for the introduction. I greatly appreciate all the hard work you've done and your team has done through Cypress as we're going through this process. But we wanted to have this webinar to be able to talk to people, talk to our patients, provide information, and just explain a little bit of what's happening in healthcare and what's happening with our practice and why we're choosing to do what we're doing. First, health insurance premiums, if you talk almost to the patient, almost everyone will say that health insurance premiums continue to go up every year. Drug costs continue to go up, especially for the Medicare patient population. There's no doubt that hospital costs continue to rise each year. And what I think this leads to, from my standpoint and from patients' standpoint, is extreme frustration. What we're hoping to do, and what we're going to talk about tonight, is hopefully provide a solution to the problem. The increased demand on our times, me as a doctor, you as a patient, financially, reduced time spent with patients has basically led to both sides being dissatisfied. The frustrating part of that is that you see who is controlling some of the things and the changes that are happening in medicine. And if we look at it, whether it is Medicare, whether it is Care First, Aetna, United Healthcare, other commercial insurances, the regulations is what is, I think, causing doctors like myself to look at other options. We're looking at a new model in healthcare, and the goal of this new model is to put you, the patient, back at the center of the healthcare experience. I look at how I divide up my time every day and how my time is spent doing different things here. The way it should be is that my energies, my efforts go to you, the patient, and you should be the center of the healthcare experience. This new model of healthcare we're talking about will allow for a much more proactive approach in many different things, such as disease prevention, enhanced care coordination, increased provider availability, and we're going to talk about that. And I want to provide a much higher level of service. This service is going to focus on your long-term health, your long-term improvement, to try to achieve optimal levels of health, not only for now, proactively, but as you get older. When I look at these new models in healthcare, I ask myself, what do patients really want? And I think it comes down to a few things that I want to talk to related to this slide and the prior slide. I think what people want is, number one, more time with me, the doctor. You want someone who's a partner with you for your care. You want access to the doctor, to me, to the office, during the day with a direct line. You want other options such as telehealth or telemedicine. You also want after hours availability. And we're going to be talking about how this model will have direct after hours availability with me. Something else that's very important and very important to me is trust. You want trust in a doctor to be your partner and to build a strong relationship with. That relationship is so important for your long-term health. I think you also want a doctor who is very knowledgeable and is an advocate for you. Advocate for you and not the insurance company or another entity, a hospital system, but an advocate for you. I think you want a doctor who has skill. He has skill to practice excellent medical care, will have the time to personalize the experience with you. And also, as we use in one of our advertisements, the spirit to care about you and your health. You want to focus on prevention and wellness. The ability to take a deeper dive into your health, take time to look at different aspects of your care. And when we look at what this is, what we're proposing, and what is happening across the country, as well as personalized healthcare or membership medicine, some would call it concierge medicine. It's a medical model that connects doctors like myself with patients like you in a very attentive long-term relationship that promotes health and wellness and provides patients with an individualized advanced level of care and service. It really emphasizes the relationship between us. And I think you've seen that there's been consistency in that relationship. I've been in town for 20 years. I don't run my office like a clinic. I have been very attentive to our patients, and we do a great job taking care of our patients. But with the changes that are happening in healthcare, I know you want more and I want more out of that. This really puts the patient back as the center, the focus of the care. It'll allow me much more time to advocate what is best for you as a patient. The changes that are happening in healthcare will continue to happen. And unfortunately, I don't always see it for the best for the patient. I would like to take that back. There are other ways. This kind of healthcare, personalized healthcare, is centered around three key elements. One is relationships, the relationship we develop and we build. Someone you can trust, again, using that word trust. And I've cared for many of you for 20 years plus. Before I was there, Jack Bulkley took care of you for many years. Some patients who are newer to me, who've had a great relationship and been able to develop that relationship, I want to build on that. Something that's very important that I believe more people want more of in any service-based industry is time. Some of the biggest complaints from patients is the doctor doesn't spend enough time with me, doesn't answer my questions. I think this is one of the most important factors to helping you be well and stay well for the long term. Communication is extremely important too. And what we're talking about with this model is direct access. No phone tree, no difficulty getting questions answered. You'll have direct communication and it will be an open line of communication. Let's talk a little bit about the benefits of what this membership model is. First, it's definitely expedited office visits, longer appointment times, 30 minutes, an hour if we need to take that time. A direct phone number during the daytime to the office, and after hour emergencies will be a direct phone line on your membership card to me. We're going to be doing an executive style annual physical, which is different for different people depending on their needs. And I want to get to that executive style annual physical I'll talk about at the end of this slide. You're going to get a detailed, in-depth focus on wellness and disease prevention, not just some of the things we just do for insurance companies or Medicare, but much more wellness discussion. Optimized patient health testing, we'll be doing some advanced testing if indicated for the patient, advanced some screening assessments. I'm going to talk about them with the annual private exam. Much more in-depth preventative treatment options, a much deeper dive again into your chronic health issues, people who have complex health issues, get you back on a path towards wellness. I especially will be a quarterback for your care and advocate your care with specialists. How many times people go into the hospital, their medicines get changed, they get discharged, they don't even know what the new medicines are, how to use them, and some may interact with the others. That's going to be my role as a primary care. That is my role as a primary care physician, and to advocate to the specialists for you. With the membership, where it's great for families, especially working families and people who have compressed time, especially the way life is now, adding a dependent to the membership at no cost at all. If a husband and wife or a couple join or a single parent joins, we will be covering dependents in this membership, as long as they are at home and from ages 7 till 26. I'm going to also host health and wellness educational events for members. We were just talking about that earlier today on some of the ideas we can brainstorm about having things such as a diabetic educator and diabetes lecture come, where we can have group meetings, when we can finally get and be able to have group meetings again in the office, things like that, or yoga or wellness programs that we could do, or just ask the doctor sessions. Let me get into benefits of membership back to the executive style physical. If we can go back to that slide, the executive style annual physical, I want to talk about a little bit and exactly what that annual physical is. It's different than what you're used to right now, and the kind of physicals we do with insurance companies and Medicare, and how it's going to be different. The main thing will be time. We're going to be scheduling these annually for everybody, and we can take as much time as we want, an hour and 15 minutes if we need to. We'll have the ability to delve into much more complex issues, do many more assessments, able to perform more procedures. For example, dermatology is something I like to do, can do whole body evaluations. I have an episcope I can use. And if I need to do procedures, I'll be able to do that without referring you. I'm going to do for the younger people and for proactive care, health risk assessments, health goals assessments. We'll be doing questionnaires and we'll be doing an in-depth discussion on that health risks, screening EKGs, extensive immunization and family history and social history. That's key, especially proactively looking in the future to try to find some risks. In certain patients, in the right patients, some cognitive assessments we could do, like the mini mental state exams. We'll look for stuff like obstructive sleep apnea and ask questions on the Epworth Sleepiness Scale. In mental health side of it, depression and anxiety screenings, much more in depth. Coronary risk evaluations, which I am very much a proponent on for preventative medicine, delving into what your coronary risk assessment is, and do we need to do anything more proactively, such as coronary calcium scores or coronary CTs of the chest. Lung cancer screening, abdominal aortic aneurysm screening. So a much more comprehensive physical with time, cancer risk assessments, dietary, exercise assessments. These are the things that are going to be part of this physical, and it's going to be much more in depth than what we've been doing to this time. What about insurance? I'm getting this question quite a bit as we're going through it. We all need health insurance, definitely. There will be a membership fee associated with these services as we're limiting the panel, and we'll have the time to be able to spend with you. Let me just be clear that the membership will not take place of your insurance. The membership fee is in addition to what your insurance is. That will enable us to make sure that we still get things covered with your health insurance, such as labs with the correct coding so that it is covered without a problem. Testing such as CAT scans, MRIs, chest x-rays, EKGs, things like that, so that those things are covered as well. This is an investment in your health. Membership medicine, when you really look at the costs, we all decide how we spend our money. And this type of membership costs less than a premium cup of coffee and a pastry per day, and less than a cable TV entertainment package each month. We all know costs in healthcare are going up, but I want to talk at the end. I really do believe if you invest in your health, how it will save you down the road. I'll use one quick example of a congestive heart failure patient who I'm able to keep out of the hospital because of good intensive care on my side, and coordinating care with their cardiologists keeps them from going to the emergency room, keeps them from being hospitalized, which saves a lot, yes, in the large number of healthcare dollars, but it saves patients a lot of money. Being able to look through your medicines and decide what are cheaper options for you. Being able to do things instead of referring you, and coordinating the care myself instead of having other people do it. To have less disjointed healthcare, less ER visits, less urgent care visits, because you won't need those things. Okay, on to the next slide. The annual membership fee is $1,800 for an individual, and for a couple it's $3,300. It's a reduced price of $1,650 per person. You can make payments for this annually, semi-annually, or quarterly. The semi-annual, of course, is $900 for the individual, and quarterly $450. And again, the membership fees are in addition to your insurance. I do want to make the point on this annual membership. We have had a wonderful response so far. I do not take this decision lightly of what I'm doing in wanting to provide better care for people. I'm super excited about it. We've been talking about it for years. And really the impetus to go down this path has been brought about not only by the changes in healthcare, but by patient demand. People coming to me to saying, hey, we really would like X, Y, or Z. And a lot of that is more time to delve into other things. Since we've launched this, and we will be launching it as of July 1st, we started 3 weeks ago with the process, 3.5 weeks ago with the process, and the response has been outstanding. I'm excited about the path that we're going on. You all may wonder, how can I participate in this? It's simple. There are a couple ways to do it via the web. One is yourcyprus.com/Dr. Patrowicz, and there's direct links to sign up. Or you can call my liaison that I have, Kelly Carpenter. Kelly Carpenter is in our office right now. You can call her directly at the membership line, which is on the screen, 410-334-3540. She's in the office every day to speak to people. You can email her as well at kcarpenter@yourcyprus.com. We also have a website that is now launched, and that website is Dr. Patrowicz, drpatrowicz.com. Oh, actually, there. Thank you, Jody. There's a slide. So drpatrowicz.com has this similar information as well as links to be able to sign up. You can learn about membership medicine. You can learn about me, learn about our practice, and you can also see the links to sign up.
Okay, Doctor.
Thank you very much, Jody.
Yes, absolutely. Thank you. Great information. We've had quite a few individuals submit some questions through the chat option. And as I mentioned before, if we don't get to your question this evening, because we do want to be respectful of everyone's time and stay on track. But let me go ahead and start with one of the questions that has come through, Dr. Patrowicz.
Yes.
The first question is, how does Medicare or my insurance work with this program?
Medicare and commercial insurance will work well with this program. You will pay your membership fee and you'll get those additional services and the time and the coordination of care and the annual physical. We will manage your commercial insurance, and I have my practice administrators and my staff that will be able to, as we do right now, submit bills to the insurance, and the insurance pays those bills according to contracted rates. Same thing with Medicare. Medicare has their base rates on what they pay. I'm still participating with all of those same commercial insurances I currently am participating with, as well as with Medicare.
Excellent. Okay, the second question is, I consider myself a healthy person, so would membership be for me?
What would the membership be for you? I think for a healthy person, a person who wants to be proactive with their health care, it is about developing that relationship with a doctor and being able to talk through questions and have the trust that you can sit down and talk with them, and also proactively with the physical to delve into things that we need to investigate, such as cancer risks, such as when should we start doing your prostate check? When should we be doing the blood work? Do we need to, because of excessive cardiac risks within your family, discuss some other alternative testing and treatments? Some stuff that insurance doesn't cover, they will cover if we put the correct coding, such as homocysteine levels or lipoprotein A levels, or getting a coronary CT and calcium score to make that decision of, should we be more proactive and put you on a statin now to help bring your cholesterol down even lower, to bottom line, reduce your chance of heart attack and stroke 10, 15, 20 years down the road. These are the kind of educational and therapeutic discussions I love having with people. And quite frankly, in today's world, we don't have as much time to be able to do that. I try my best to be able to take that time. We are going to have that time in this model.
If I have an urgent situation and it's the weekend, will I be able to call you?
Yes. Members who are part of this plan I mentioned earlier will be getting a card, and that card will have direct access to me to be able to contact me. And for after-hour emergencies, nights and weekends, I'll be there for you. You will not be going through a phone tree. You won't be going through a answering service for 30, 45 minutes and speaking to someone in another state. You will pick up the phone, have the confidence in me, and we're going to have that relationship to be able to call me, and we're going to help solve your problem.
If I need to see a specialist, will I need to see you prior to that visit?
I'm sorry, will you be able to see me prior to that visit?
Correct. So I think what the question is if I have a need to go see a specialist, will I work through you to get that? Like, maybe talk a little bit more about the care coordination. I think that's where this question's coming from.
First, in a traditional sense, as we do it now, I think that will be the same. If I feel I need to send you to a neurologist, we will be making those arrangements and those appointments. And I will be using my availability to be able to call and coordinate that care and be able to speak to the doctor and be able to go through your problem and be able to speak maybe before the visit with the doctor and definitely after, to try to get the answers that I want and the answers that you want. The care coordination part of it, I think, is so important, especially for people with multiple medical comorbidities, because people are getting care in many different silos. it makes sense to have one person who is able to sort of put the pieces together to say, well, maybe you don't need to be on this medicine. And, oh, these two medicines do the same thing. I'm not sure why you're on them. Let's make sure that the cardiologist, that's what he wanted, and be able to call the cardiologist and coordinate the care that way. Between multiple specialists, it's difficult sometimes to coordinate that care, but it is important because it's better for your health. I saw in the chat line, there's a related question to that. I saw Lori had a question, which she mentioned about hospitalization. What will I be doing? Will I be seeing patients in the hospital? The hospital, our local hospital here, is run by the hospitalist program, a program I used to be part of and was one of the people when it first was started. And still the director there is Dr. Simona Eng, who I'm very close with. The care coordination that's going to happen is much more intensive look at you being in the hospital daily, being able to speak to the providers, and upon discharge, being able to get you in right away so that everyone's aware, we're all on the same page of what's best for your care. I hope that answers the question.
Great. Okay, let's see. Just a couple more that we have time for. The question is, you had mentioned that spots are very limited and that they're also filling. Can you share a little bit more about what will happen if you do reach that capacity?
Sure. I think that there, and when you look at practices like this across the country, there's sort of a sweet spot of what's manageable, because if you're paying for a service, you want to be able to have that level of service. When we get to the number that we feel is a comfortable number, which we've put it at 300, there'll be a waiting list after that. We'll be able to take new people in as people either drop out of the plan or don't want to be part of the membership plan anymore. But once we get to that number, we're going to have a waiting list after that.
Okay, and a person has asked if they're able to sign up from their home computer, or is it better to call in to speak to Kelly?
Yeah, you can do either. When you look at the Your Cypress web link, or you look at drpatrowicz.com, there are ways to click on there. There's the membership phone line, and also emailing Kelly Carpenter at kcarpenter@yourcypress.com. You can sign up any of these ways. The most direct way is to call Kelly at our office while she's there during office hours to be able to speak to her, answer any questions, and sign up. But you can also do it directly through the web.
Excellent. Dr. Patrowicz, do you want to go ahead and close with any other thoughts? Or
Sure. I just want to say to everyone, it's been my privilege for the last 20 years in Salisbury of having a practice, to be able to practice the way I feel a family physician should practice and be engaged in the care and want to care. I've always believed that one of my old adages was that the best time to choose a doctor is when you don't need a doctor, to develop that relationship. I think I'm a very approachable person. I'm a person who can sit down and discuss pros and cons to different treatments, and to provide a good educational base on evidence-based medicine, but also understand the alternative treatments and to help you on your path to wellness. That's what I want to focus on. That's what I want to do for the rest of my career, and take outstanding care of people, a level that nobody, in my opinion, is doing in our region. And I hope you want to go on that journey with me.